The Affordable Care Act is certainly one of the most controversial issues in front of the American public right now, but politics aside, what is it doing in Colorado? Hello, welcome to Comcast Newsmakers. I'm Beverly Weaver, and with me now is Dr. Bill Burman, Director of Denver Public Health. We're going to talk about this at length. Dr. Burman, tell us how you see this Affordable Care Act being implemented in Colorado right now.
Colorado's taken the Affordable Care Act and really trying to make it a success. The two key parts that Colorado's made a decision is to expand Medicaid. Not all states are doing that. And also Colorado's developed its own health insurance marketplace called Connect for Health Colorado. So in both of those ways, Colorado's trying to embrace the opportunity of the Affordable Care Act to make health insurance more widely available.
Right. And with nearly 20% of Denver residents uninsured right now, certainly that has an impact. Talk about how that translates to across the state, Dr. Burman.
Well, the uninsurance rate in Denver is somewhat higher than the state as a whole, but not a lot. It's about 16% for the state as a whole. In other metropolitan area counties, it's similar, 17% in Jefferson County, 21% in Adams County. So lack of health insurance is very common in Colorado.
Right. And I think a lot of the confusion comes just from lack of information, lack of knowledge about how to get into the system. I understand there's resources in place to really help people enroll. Tell me what's available, how people tap into that.
Sure, there's very nice opportunities to be helped with the Affordable Care Act expansion. One is that there are health insurance enrollment assistance sites around the city, around the state. Those are funded by Connect for Health Colorado. In Denver, those involve Denver Health, Denver Human Services, community-based organizations. So there are enrollment sites around the community.
In terms of somebody sitting down and having a one-on-one conversation, about their own health concerns and what plan might best benefit them, is that available as well?
That's what the enrollment sites are for, exactly that.
Okay.
So it's trained people who have online resources as well as the ability to counsel you about health insurance.
Yeah. I know that the pressure of a deadline certainly scares people when it comes to you've got to have this done by X time. Do you feel like most people are working, to get that insurance and they understand what the deadlines are?
Well, first, there is no deadline for Medicaid. Medicaid enrollment happens throughout the year, and so Medicaid enrollment's going very well, and we expect it to continue to. The deadline that you've heard about is about the Connect for Health Colorado, the health insurance marketplace. If you want coverage by January 1st, 2014, you need to sign up by mid-December. So that deadline is out there.
Yeah. And health-wise, talk a little bit about how having health insurance in place can help people. I know we hear about people with pre-existing conditions who haven't been able to get insurance before, but overall, how does it affect a population?
Lack of health insurance causes a number of problems, both for the individual and for the broader society. For the individual, it means they have difficulty accessing care. Their care tends to be episodic and in emergency rooms and places like that. That's not the way to get medical care. That results in poor health outcomes and increased risk of premature death. And then you mentioned the problems of premature conditions. Those go away with the Affordable Care Act. Insurance cannot be based on a pre-existing health condition.
Right. And is there an economic cost to the society in general with lack of coverage?
Absolutely. The healthcare system responds to people who don't have insurance by shifting their costs to others. So there's a very direct effect in that the health care costs for those who are uninsured get shifted to government insurance, Medicaid, Medicare, and also get shifted to employer-sponsored health insurance.
Right. And with the controversy surrounding this, Dr. Burman, what's your forecast for the next 5 years in Colorado? Do you see the bulk of people who are uninsured now having insurance?
I think Colorado is going to make this a success. And the prediction is that well over 500,000 Coloradans will be able to get health insurance through this. So I think we're going to make it a success.
Okay. Where can people go for more information?
They can go to the Denver Health website. They can go to Connect for Health Colorado.
Okay.
Both are good places for online resources.
All right. Dr. Bill Burman, the Director of Denver Public Health, thanks for being with us.
Thank you.
And thanks for watching Comcast Newsmakers. I'm Beverly Weaver.